Dr. Atul Grover is the Chief Advocacy Officer for the Association of American Medical Colleges, and he happens to think this healthcare reform is pretty good. Dr. Grover, first of all, welcome to the Young Turks.
Thanks for having me.
First, let's explain to people what the Association of American Medical Colleges is.
Well, we actually represent all of the medical schools in the United States and Canada, so all the folks that give people their MDs, and we also represent the teaching hospitals that actually train all the next generation of physicians and most of the other health professionals out there as well.
All right, so you guys are obviously want to protect the interests of doctors. That makes sense, right?
Well, I think we want to protect the interest of the American public and all the patients in the communities we serve.
I hear you on that. Those are your constituencies. Let's just put it that way. So let me start real broad. What did you think of the legislation that was passed?
I think the legislation is a great first step in terms of expanding coverage to 32 million people who don't have access to health insurance. And, you know, our institutions actually take care of, collectively, almost 70% of all the charity care cases in the United States. And so every day, our doctors and hospitals actually see people coming in who wouldn't really be that sick if they actually had access to good health care and access to insurance.
That's interesting, too, because then it also makes financial sense, because instead of the hospitals, et cetera, and these medical facilities getting stuck with a bill for all those uninsured people, they're going to be part of the system. Is that right?
Well, that's the hope, and I think that the next couple of years will bear that out to figure out whether that's the case. I mean, right now, we do get some support from the federal government and through state governments, through Medicaid, to make sure that we help offset the cost of all the people that we take care of who don't have insurance. And over the next 10 years, the bill would actually phase out a majority of that funding. And so I think we're going to need to monitor exactly how many people are coming in, who has insurance, and balance that out with a decrease in some of the subsidies that we get. And I think that one of the concerns that we always have is that as a big part of the nation's safety net, people always fall through the cracks, and people will continue to fall through the cracks. And I think we just have to make sure that we follow all that information and make sure that people are getting the care that they need.
All right. Now, some of the right-wingers in the country claim that, look, I'm trying to be polite for no reason. The entire Republican Party claims that this is a socialist takeover of health care. Is there any truth to that?
You know, I'm not a political scientist. I'm a physician, and you know, I work with teaching hospitals and I work with medical schools, so I'm probably not the best person to ask about that. What I will tell you is that we have, at the basic core of this program, a foundation of working on state-based exchanges with private insurance companies so that people who can't afford to get their own health insurance coverage will get subsidized. So if you want to think of that as government intervention, it's government intervention. We have expansion of the Medicaid program, which certainly has its challenges, but I think is a valuable part of the safety net. There's an expansion of that across the states, with the federal government picking up a lot of the costs of that expansion. I think there's some changes to the regulation of insurance companies, which will probably be helpful for most Americans, and I'll leave it up to your listeners to define whether that is socialism or not.
So, you know, we have some expansion of subsidies and we have some expansion of Medicaid, but is there any government organization that, now you guys are the doctors, that come between you and the patients? Is that part of the bill?
I don't think so. You know, there is an investment in also comparative effectiveness, which is research that's meant to look at the relative efficacy of different treatments. Doesn't involve cost. They've been quite explicit in the legislation that the research shouldn't be supported to sort of deny people care on the basis of cost, and hopefully it'll get more information to doctors and to the patients out there so they can make better decisions. You know, I don't know of any part of the legislation that directly interferes with the doctor-patient relationship.
We're talking to Dr. Atul Grover. He's the Chief Advocacy Officer for the Association of American Medical Colleges. So finally, on the issue of costs, I don't really see anything here that's going to prevent insurance companies from raising premiums. Am I seeing it wrong?
Well, I think, part of the adjustments that the president made in the final days of the passage of this legislation, which hopefully will get through the Senate and the House in terms of the adjustment to the package, include some attention to rate setting, and I think the stuff coming out of California in terms of the large rate increases certainly brought a lot of attention to this. But I would actually pay more attention to some of the pilot programs, some of the demonstration programs that would give doctors, hospitals, home care, post-acute care providers more flexibility in trying to figure out what we can really do to lower costs for everybody. So costs to the payers, costs to the people that are actually paying for the cost of premiums, those patients out there, to really lower costs across the system. And I think that my hope is that in the next 5 or 6 years, we together, doctors, patients, hospitals in our communities, can figure out how to, quote unquote, bend that cost curve.
And how does the bill encourage that?
Well, there's about $10 billion that's put into Medicare and Medicaid's administration that would create something called an innovation center. And the charge of that center is really to try and go out there and invest in new programs that you'll hear terms spread around like medical homes, accountable care organizations. These are all really fancy ways of saying that we're trying to allow doctors and their patients and hospitals to come together to figure out how to share accountability for care, how to make sure that we can create a health system that really works for patients and for communities. And part of the problem is that we haven't always had the flexibility, the incentives to do that. So this is really a $10 billion investment in something that would give people at the community level the flexibility to try something different.
You're more optimistic about that than I am, because I think that's a good part of the legislation. In fact, this might be my favorite part of the legislation, but I think it'll take at least 10 years before we get anything that's workable that might begin to lower costs. And frankly, I think by that time it'll be too late. And by too late, I mean premiums will be so high that there's going to be some sort of revolt over it. And so
I think that's what we're all trying to avoid.
Yeah, all of us except the insurance companies.
Luckily, I don't work for insurance companies, so I don't have to say anything about that.
All right, then we'll leave it right there.
All right.
Dr. O'Toole Grover, thank you so much for joining us.
Thank you for having me.
Watch the live show at theyoungturks.com.